Title: Kate Middleton's illness for William, and alert on the BBC for Charles III. From virus to cancer, the disease that Kate Middleton suffers from has been identified as human papilloma. This news, which seems to have originated in Spain, has created a strong impact worldwide, leaving many questions unanswered. The mystery surrounding Kate Middleton's condition has only deepened. However, amidst this, there is another controversial development involving Carlos Torrero, a journalist from the BBC who has been awarded an honorary title by the English monarchy. This is the first time such an appointment is taking place, and it has sparked considerable debate. Both candidates for the position belong to the BBC, and we will provide all the details. But first, let's delve into the news about Kate Middleton's illness. It is possible that you haven't come across this news before, whether on YouTube or while searching the internet. Initially, I didn't find any significance or credibility in it either. However, now even reputable media outlets are reporting on it. According to a Latin American media source, after Kate Middleton announced her battle with cancer, she retreated from the public eye, leaving the world with many unknowns about her condition. Recently, a new piece of information has emerged, suggesting that the cause of her cancer might be the human papillomavirus HPV. This virus is known to increase the risk of cervical cancer. While the Crown has not disclosed specific details about Kate Middleton's health, medical sources have shed some light on HPV. Human papilloma refers to a group of related viruses that can cause warts in various parts of the body. There are over 200 types of this virus, with around 40 of them affecting the genitals. It is primarily transmitted through sexual contact with an infected person. In addition to cervical cancer, high-risk HPV can also lead to cancer of the anus, mouth, throat, vulva, vagina, and penis. The news about Kate Middleton's illness initially emerged from a Spanish media outlet that frequently covers stories about the monarchy. At first, I didn't pay much attention to it, but now it seems to have gained momentum. However, it is important to note that there is no concrete evidence supporting the connection between cervical cancer and HPV in Kate Middleton's case. Moving on to the appointment of the royal editor at the BBC, this development has also stirred controversy. The BBC is on the verge of crowning its first royal editor, a position created amidst the battles against cancer faced by Kate Middleton and King Charles III. The two candidates, Daniela Oraf and Carlos Io, both have ties to the royal rota and are close to Buckingham Palace, Charles, and Camilla. This appointment can be seen as a noble title, and the selected candidate will take on this newly created role. One of the candidates has limited experience in covering the royal family, but has been a local editor since 2004, overseeing major stories. This candidate is known for bringing a bolder approach to BBC royal production, as the corporation is sometimes criticized for being too cautious in its coverage. The other candidate is a woman, and it would be seen as a positive step if BBC News appointed her. BBC News did not announce the position externally to give in-house journalists the opportunity to apply and avoid redundancy. The cost-cutting initiative announced last year resulted in the closure of several roles, including the local editor's position held by Easton. Qualified candidates from various media outlets, such as the Sunday Times, CBS News, and ITV News, were excluded from the hiring process. Channel 4 and 5 were also considered, but ultimately, the new royal editor of BBC News will play a crucial role during a challenging time for the British monarchy. With the health issues faced by Charles III and Kate Middleton, the BBC's coverage of key national events and deaths will be under intense scrutiny. This development has generated controversy in the UK, primarily due to the close association between Buckingham Palace and the BBC. While the BBC is considered the most prestigious channel in Europe, it is not without flaws. The decision to involve public radio and television in the affairs of the royal family has raised eyebrows. Collaborating with sensational tabloids was not enough. Now the royals will have a presence in public broadcasting. While I have faith in the professionalism of these individuals, it is a move that has surprised many, especially considering the ongoing health crisis. The debate surrounding this issue is different, but it raises questions about the connection between Buckingham Palace and public radio and television. The news of Kate Middleton's illness has not only sparked curiosity, but also raised concerns about the potential impact on her husband, Prince William. As the future King of England, William's role becomes even more crucial in light of this unfortunate development. The public is eager to know how he is handling the situation and what support he is providing to his wife during her battle against cancer. It is important for the royal couple to maintain transparency and share updates on Middleton's progress, as this will not only reassure the nation, but also encourage others who may be facing similar health challenges. Furthermore, the appointment of a royal editor at the BBC has led to speculations about the network's motives and potential biases. Some critics argue that the decision to create this position is a strategic move to control the narrative surrounding the royal family and ensure favorable coverage. Others believe that having an internal royal editor will provide a more comprehensive understanding of the monarchy's inner workings and foster a deeper connection between the institution and the public. In any case, the appointment process should be transparent and merit-based, with qualified candidates from various media outlets given an equal opportunity to apply. This will help maintain credibility and avoid any perception of favoritism or exclusivity within the BBC. As the British monarchy faces health challenges and scrutiny surrounding its coverage, it is crucial for all parties involved to prioritize transparency, professionalism, and public trust. The decisions made in relation to both Kate Middleton's illness and the appointment of a royal editor at the BBC will shape the public's perception of the monarchy and its relationship with the media. Additionally, the ongoing health crisis has brought attention to the importance of early detection and prevention of diseases. It serves as a reminder for individuals to prioritize regular checkups and screenings to catch any potential health issues at an early stage. This not only applies to members of the royal family, but also to the general public. By staying informed and proactive about our health, we can increase the chances of successful treatment and improve overall well-being. Moreover, the discussion surrounding the connection between Buckingham Palace and public radio and television raises broader questions about the role of media in a democratic society. While the BBC is known for its impartiality and journalistic integrity, the close association with the monarchy can be seen as blurring the line between news reporting and maintaining the institution's image. It prompts a reflection on the delicate balance between journalistic freedom and public interest, as well as the potential influence exerted by powerful entities on media organizations. The impact of Kate Middleton's illness on the British monarchy extends beyond just the immediate concerns for her health. It also raises questions about the succession plan and the future of the royal family. As the wife of the future king, Middleton plays a significant role in the public's perception of the monarchy, and her illness brings attention to the fragility and mortality of even the most prominent figures. In light of this development, the royal family may need to reassess their priorities and adapt to the challenges posed by Middleton's condition. This could include reevaluating their public engagements, taking steps to raise awareness about the importance of early detection and prevention, and ensuring that appropriate support systems are in place for individuals facing similar health battles. Additionally, the appointment of a royal editor at the BBC signifies the evolving relationship between the monarchy and the media. It highlights the monarchy's recognition of the need for more strategic communication and a stronger presence in the public sphere. By having an internal royal editor, the BBC can potentially offer a more nuanced and balanced perspective on the monarchy's activities, addressing criticisms of sensationalism and promoting a deeper understanding of the institution. Furthermore, the controversy surrounding this appointment emphasizes the delicate balance between maintaining the independence and impartiality of the media while still serving the public interest. It is essential for the BBC, as a public broadcaster, to demonstrate transparency and accountability in its decision-making processes, ensuring that the royal editor position is based on merit and expertise rather than personal connections. The public's concern for Kate Middleton's illness extends beyond her immediate family. People are also eager to know how her children, Prince George, Princess Charlotte, and Prince Louis, are coping with the news. The impact of their mother's illness on their emotional well-being cannot be underestimated. It is crucial for the royal family to ensure that the children receive appropriate support and guidance during this challenging time. Furthermore, the announcement of Kate Middleton's illness has brought attention to the importance of public health initiatives and research. This incident serves as a reminder for governments and healthcare organizations to prioritize funding and resources for the prevention and treatment of diseases like cancer. By investing in early detection methods, accessible healthcare services, and public education campaigns, we can collectively work towards reducing the prevalence and impact of such illnesses. Additionally, the appointment of a royal editor at the BBC prompts discussions about diversity and representation within the media industry. It is essential for news organizations to ensure that their editorial teams reflect the diversity of their audiences and society as a whole. This includes considering candidates from diverse backgrounds and perspectives, as well as fostering an inclusive and equitable work environment for journalists. Moreover, Kate Middleton's illness emphasizes the importance of destigmatizing conversations surrounding cancer and other serious illnesses. By openly discussing her diagnosis and treatment, Middleton is contributing to breaking down barriers and encouraging others to seek support and share their experiences. This can have a positive impact on individuals facing similar health challenges, providing them with a sense of community and empowerment. In response to Kate Middleton's illness, there has been an outpouring of support and well wishes from people all over the world. Many individuals and organizations have taken this opportunity to raise awareness about the importance of regular health checkups and screenings. The news has also prompted discussions about the role of healthcare systems in providing accessible and affordable care for all, regardless of social or economic status. As for the appointment of the royal editor at the BBC, there is a growing demand for transparency in the selection process. The public expects a thorough and fair assessment of candidates' qualifications and expertise, ensuring that the chosen individual is truly deserving of this prestigious role. It is crucial for the BBC to address any concerns regarding bias or favoritism and uphold its reputation for objective and unbiased reporting. Furthermore, the appointment of a royal editor brings forth the need for increased media literacy among the general public. With the proliferation of fake news and misinformation, it is essential for individuals to critically evaluate the credibility and accuracy of the information they consume, particularly when it comes to news about the royal family. Developing critical thinking skills and verifying sources can help mitigate the spread of false information and maintain public trust in the media. In light of Kate Middleton's illness, there has been a renewed emphasis on the importance of mental health support for individuals facing serious illnesses. The emotional toll of such a diagnosis can be overwhelming, not only for the patient, but also for their loved ones. It is crucial for healthcare systems to provide comprehensive care that addresses both the physical and emotional well-being of patients and their families. This includes access to counseling services, support groups, and resources to navigate the challenges of living with a chronic or life-threatening illness. The news of Kate Middleton's illness has undoubtedly drawn attention to the importance of early detection and prevention methods. It serves as a reminder for individuals to prioritize regular health checkups and screenings, particularly for diseases like cervical cancer. Public health organizations can seize this opportunity to launch awareness campaigns highlighting the significance of vaccination against HPV and the availability of screening programs. Moreover, the ongoing discussions surrounding the appointment of a royal editor at the BBC have sparked conversations about the need for diversity and inclusivity in the media industry. News organizations should actively seek out candidates from diverse backgrounds and perspectives, ensuring that their editorial teams reflect the multicultural society they serve. This will foster a more comprehensive and accurate representation of the royal family's activities and promote a greater understanding among viewers. Furthermore, the appointment of a royal editor presents an opportunity for the BBC to showcase its commitment to fair and unbiased reporting. By selecting a candidate based on merit and expertise, the BBC can dispel any concerns of favoritism or partiality. This will reinforce the trust of viewers and maintain the integrity of the public broadcaster. In light of Kate Middleton's illness, it is crucial for the royal family to provide support not only to her but also to their children, Prince George, Princess Charlotte, and Prince Louis. Ensuring that the children receive proper guidance and emotional assistance during this challenging time will help them cope with the news and promote their overall well-being. Additionally, the appointment of a royal editor at the BBC signifies a strategic move to enhance the monarchy's communication efforts. By having an internal royal editor, the BBC can establish a stronger connection between the institution and the public. This can facilitate a more nuanced understanding of the monarchy's inner workings and dispel any misconceptions or stereotypes. Furthermore, Kate Middleton's illness has garnered worldwide support and well-wishes. This exceptional response highlights the global significance of the British monarchy and its impact on people's lives. It also underscores the universal concern for health issues and the importance of solidarity in facing such challenges. In conclusion, the news of Kate Middleton's illness and the appointment of a royal editor at the BBC have sparked discussions and raised important questions about public health, media representation, and the future of the British monarchy. The news of Kate Middleton's illness has raised concerns about her husband, Prince William, and the potential impact on the future of the British monarchy. The appointment of a royal editor at the BBC has also sparked debates about media biases and transparency. It is crucial for all parties involved to prioritize transparency, professionalism, and public trust. Additionally, this development emphasizes the importance of early detection and prevention of diseases, as well as the delicate balance between journalistic freedom and public interest. The British monarchy must adapt to the challenges posed by Middleton's condition and reassess their priorities. The appointment process for the royal editor should be transparent and merit-based, ensuring diversity and inclusivity within the media industry. The public's concern extends to Middleton's children, and appropriate support should be provided to them. This incident also highlights the importance of public health initiatives, research, and destigmatizing conversations surrounding serious illnesses. The appointment of a royal editor signifies the evolving relationship between the monarchy and the media, prompting discussions about media literacy and the need for diversity and inclusivity. Mental health support for individuals facing serious illnesses is crucial, and the importance of early detection and prevention methods should be emphasized. The appointment of a royal editor presents an opportunity for the BBC to showcase its commitment to fair and unbiased reporting. The royal family must provide support to Middleton and their children, while the BBC should establish a stronger connection between the monarchy and the public. The global support for Middleton's illness highlights the universal concern for health issues and the significance of the British monarchy. Overall, these developments raise important questions about public health, media representation, and the future of the monarchy.